to show you today electric stimulation, and so this is going to be for motor application to create wrist extension. And we're going to start by turning on the machine, because that's the first thing you want to do. You want to make sure that you're not connected to the patient at all when you're turning on the machine. It should be on first, and then we'll connect the patient to the machine. So the other thing we're going to do first is I've cleaned off her forearm. I took some alcohol and a towel and I just cleaned off these areas, and I'm going to place the electrodes there. That helps if there was lotion on that area, or if there's any reason that there would be extra oils. It makes for decreased impedance and a better connection for the electrodes. If someone's really hairy, we might clip the hair or even shave them. Electrodes are on, machine is on, so now we're going to set our parameters. And so this is a machine called, from Chattanooga. We're going to go to the electrotherapy setting. It's a pretty fancy machine. It does a lot of different things. And look at all that. There are so many options here. We're going to go to VMS, which is variable motor stimulation. So we're going to press that button and go to VMS again. And we're going to see the default settings, where we have our waveform that Chattanooga calls VMS, variable motor stimulation. This is a single channel mode, meaning that it is one channel, 2 electrodes. We are having a cycle time of 1050. That's for someone who has a very atrophied area that we're trying to strengthen. And I'm actually going to modify that in a moment here. The frequency is 50 pulses per second. Remembering that 50 pulses per second is necessary, is a good amount of frequency to create muscle stimulation, enough action potentials to create a muscle stimulation without over fatiguing it. Ramp time is 2 seconds. It'll take 2 seconds to get to our maximum intensity. Our phase duration is 200 microseconds, and the treatment is for 20 minutes. I am going to edit this because our patient is actually not completely atrophied, so I'm actually going to take the cycle time to 10:20, 10 seconds on and 20 seconds off. So from here, I am going to let our patient know that I'm going to let her know what our plan is here. So what I'm going to do is gradually turn up the intensity, and what you're going to feel is an initial sensory experience, a tingling or a buzzing. And as that's happening, when it first happens, please let me know so I know how to continue adjusting here. Now I want to let you guys know that when I put the electrodes on here, I put the electrodes right on motor points. I put them right on the belly of the muscle. That's because I wanted a motor reaction. If I wanted just sensory, I'd want it to be strong and tingly. I need to be off these motor points. I would place the electrodes elsewhere so that they're not on the muscle belly. That will guarantee me almost. It gets tricky to get completely off of motor points, but I want to get as far off of motor points as possible so I can just have that sensory experience. For this setup, I actually want to be on the motor point because I want you to see what it looks like when the motor points are stimulated and you get the wrist extension. All right, so first of all, I'm going to turn this up. Let me know when you start feeling the kind of a tingling sensation. This is a pretty sensitive machine, and so it does take a bit of time for that to occur. We're probably getting close. You're probably used to it now. A little bit? Okay. So she just started feeling a little bit of sensation. That's at 10 milliamps. And now it's getting stronger. So right now, because we're just activating the cutaneous fibers, we are getting a sensory experience without the motor. And remember on the strength duration curve, when you're getting a little bit of motor, good. So I'm going to turn that down a little bit. Perfect. So I just want you to know right now, you don't see any motor activity. It's a strong sensory experience. The strength duration curve, remember, says that that first curve is an A beta, that sensory nerve fiber that's going to be stimulated. Now as we get higher intensity, we can actually stimulate the motor nerves. So we're going to go a little higher, and we're going to watch for, and I'm actually starting to see some activity here on the index finger for extension. I'm going to keep going up. Are you doing okay?
Yeah.
Good. And now look at that. We're getting some, oh, I got some everters. I got some ulnar deviators this time. And I'm going to turn the machine on. I'm going to press start now. And that you see that her hand automatically stops, and then it's going to start right back up again. 10 seconds on. And then after 10 seconds, it's going to go off because we want some rest time to allow for the muscle to regain some strength, so we minimize the fatigue. We want to be able to get 15 to 20 repetitions, so we need to make sure there's enough rest time to allow that without fatigue. So it'll come back on, and you'll see, that she's got some ulnar deviation, so that means that the electrodes were set up in such a way that we're skewing a little bit toward extension with ulnar deviation. I could move the electrodes maybe a little bit more medial and get more of a direct extension experience. We'll do a couple more rounds of this. And again, after 20 seconds, remember I set up 20 seconds because I wanted to be sure that there would be some rest, but since she wasn't completely fatigued and atrophied, that we could have a smaller rest time than the 50-second rest time, which is recommended for small and atrophied muscles. All right, so that's what that looks like. During, you can always, if they lose some of the activity that you want out of that joint, you can, during the on time actually, you can ask the patient, does that feel strong enough? Okay, so I could, during that time, turn it up. If she was losing that contraction, I could actually turn it up during that on time. But she's doing fine, so I'm not going to do that. And then we're back down to that rest time. So when the treatment is over, you'll hear a beep. It would be another 18 minutes from now. So I'm going to go ahead and stop for our purposes. And then once the machine is stopped, I'm going to disconnect the patient from the machine. And then I can turn off the machine, because we don't want to turn the machine on or off while the patient is connected. These machines are super safe. There's surge protectors, but it's just an extra safety measure to make sure that they're disconnected during the on and off, during the time that you would turn the machine on and off. From there, you can place the lead wires carefully around these little hooks so that they are not damaged. If you wind them up real tight, you can damage the wires inside. And then we're going to remove the electrodes carefully. You never want to pull from the wire. You want to take it up and pull in the direction of the hair so that you don't create irritation from pulling the hairs. Same thing down here. Kind of hold onto the skin, give it a good kind of a band-aid pull off there. Check the skin, see if there's any changes, any discoloration, because this is a pulsatile current. It is a balanced waveform, so we wouldn't expect to see redness or any changes here on the skin because there's no charge. There's no leftover positive or negative charge that would actually irritate the skin. So sometimes you'll see a little bit of an outline of the electrode. I don't see any of that here. Maybe a little bit of red right there. But that is, it's hardly noticeable at all if that's even from the electrode.
More from pulling it off.
And it could be more from pulling it off, actually. So that concludes our electric stim video.